Arkansas Governor Asa Hutchinson vetoed a controversial bill that would ban gender-affirming care for transgender minors. The governor says it would make the state the oracle of medical care in private issues between patients and doctors.
While in some instances the state must act to protect life, the state should not presume to jump into the middle of every medical, human, and ethical issue. This would be and is a vast government overreach.
The state's General Assembly, however, could override the veto with a simple majority vote. Joining us now to break down the state of the bill is NBCOut.com reporter Jo Yurcaba. Jo, good to have you with us. So first, just to help us remember what's in this bill, can you briefly summarize what was in the bill on transgender medical care and if it became law, who it would affect?
Sure. So the bill would have banned access to gender-affirming care for trans minors. So that's people under 18 years old. And that means it would have banned their access to puberty blockers, which temporarily pause puberty for younger teens, and hormone therapy, which is what older trans teens use. And it would have affected not only those who want to access care, but also those who are already using this care. So it would have stripped them of this access when it's care they've already been receiving.
So, Jo, the state's Republican governor leaned on a very conservative value here, pushing against potential government overreach into a citizen's medical decisions. Can you tell us more about why specifically he says he vetoed it?
Sure. So in addition to saying that it would have intervened in these private medical decisions, Governor Hutchinson also said that he vetoed it because the bill was born out of this idea that trans minors are having surgery when minors in Arkansas aren't receiving gender-affirming surgeries. He also said that it made his heart hurt to think of the young people already receiving transition care who would have suddenly lost it as a result of this bill. And he also added that research has shown that denying transition care to trans young people can lead to increased suicidal ideation and an increased risk of substance misuse, among other mental health issues.
And Jo, as we mentioned, the bill is not quite dead yet. The state legislature, their General Assembly, could easily override the veto. They only need a simple majority, which was actually surprising for me to hear. How likely are they to exercise that option? Do we have any idea if maybe the governor's words are going to influence some Republicans to change their vote?
Yeah, so it seems incredibly likely, given that the bill did pass in the House and Senate with overwhelming support. And so that's why advocates have told me that they're really trying to keep sustained pressure on legislators in the hopes that they'll change their votes given what the governor has said about the bill. But it's unclear on the likelihood of that. So they're kind of it's up in the air a bit as of right now.
We'll see what happens. Jo Yurcaba, thank you so much for joining us this morning. We appreciate it.
Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.